Hello, students. Welcome to Mental Health. This is the last chapter in the entire book, but it also might be one of those chapters where you're going to be able to look at a variety of these things. It actually goes a little bit more in depth about some of the nitty-gritty details compared to some of the other different types of sections. But overall, I think that a lot of these different types of terminologies, rather than living in the physiology or anatomy type of space, it lives more in the psychology space, and they're more talked about in a regular type of basis. You may not necessarily understand exactly what they mean per se, but they're a little bit more well known in the broader scheme of things. When we are looking at what mental health and mental health disorders are, the book ends up going by the WHO or the World Health Organization's definitions. Health as being a state of complete physical, mental, and social well-being, not just the absence of disease. It's actually the you're doing well for yourself in all aspects, not just you're not doing poorly. Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. When you have a mental disorder, by definition, it's an abnormal condition of the brain or mind. There are some of these different types of things that can be visible or have visible aspects, and some of them can be very hidden. They affect the way that a person thinks, feels, behaves, and relates to others in his or her surroundings, or their surroundings, and in most cases, the exact cause of mental disorders is unknown, which is actually the sticky part of this whole thing, or they may have multiple factors that contribute into one thing. These different factors that could contribute include genetics, the environment in which you live or grew up, chemical changes that are occurring in your brain, the use of certain drugs, psychological, social, and cultural conditions. There are two broad categories of mental illness, AMI, which is any mental illness, and SMI, which is serious mental illness. So within, and that's actually kind of an awkward way of thinking about it. You can think about it as a very large circle, which is any mental illness, and that includes the smaller subset of serious mental illness that have a very large impairment on function of the individual. There's a number of different types of conditions that are considered mental illnesses, including anxiety disorders, attention deficit hyperactivity disorder or ADHD, autism spectrum disorders, bipolar disorders, depressive disorders, feeding and eating disorders, including things like anorexia or bulimia, as well as overeating types of disorders. Obsessive compulsive disorders, schizophrenia, trauma and stress reduced related disorders, including PTSD or post-traumatic stress disorder. Other different types of mental disorders that are not necessarily as seen in a variety of places include adjustment disorders, dissociative disorders, factitious disorders, somatic symptom disorders, and tic disorders. There are some different types of sexual and gender disorders that it can also be considered part of mental disorders, but not necessarily, and it depends on what the contexts are that you're actually talking about. A couple stats just to throw out there: nearly 1 in 5 U.S. adults live with a mental illness, and that number is actually growing. Among the top 10 leading causes of mental illness or disability in the United States are major depression disorder, bipolar disorder, and schizophrenia. There's a lot of very specific disorders that are covered throughout the rest of the chapter. I wanted to give a broad overview. They all have very specific definitions. Try to go through as best as you possibly can and try to focus on the roots to be able to better understand the ideas of what the disorder actually encompasses. If you break down the different types of words into the individual different chunks, then you can gain a slightly better understanding of how it actually works. Once again, if you have any questions about any of these different types of things, then please come to me and ask any types of questions that you may have. As far as abbreviations go, there's a whole lot of abbreviations, and they range from organizations like NIH, which is the National Institutes of Health, NIMH, which is the National Institute of Mental Health, APA, the American Psychiatric Association, to specific types of diseases: OCD, obsessive compulsive disorder; PD, personality disorder; ADHD, attention deficit hyperactivity disorder, etc., or ASD, which is autism spectrum disorder, or a very wide variety, to a variety of different types of other things, including abbreviations like CBT, which is cognitive behavioral therapy. It's a way of treating a disorder. Or PDD-NOS, pervasive developmental disorder not otherwise specified. It's actually kind of a blanket term that's slapped on a number of different types of things, where you can tell that there's some sort of developmental disorder that has ended up affecting the individual, but it falls into a broader category or can't be directly pinned down. A number of other types of things, some other interesting bits. There are some drugs also, SNRI, which is serotonin norepinephrine reuptake inhibitor, or SSRI, selective serotonin reuptake inhibitors. Sorry. If you remember back to the chapter on the nervous system, serotonin, norepinephrine, both neurotransmitters that deal with a variety of mood-based things. One other thing that you will also see often is the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. I believe that they're working on a 6th edition, but I believe also that they've been working on a 6th edition ever since the 5th edition came out. These come out every, 15 to 20 years or so, and change what is considered normal and what is considered a mental disorder or some other different type of disorder. Things have changed over time. And if you look back at earlier versions of the DSM, different things can be considered, things that are now considered normal would have been identified as being a mental disorder. So interesting types of things to think about. So that is a variety of different types of things that you can think about as far as all of this goes. I thought that it was one of the more approachable chapters in the whole entire textbook, with more, like I said at the beginning, specific types of ways of approaching information rather than the previous ones, which were very heavy on the here's a specific minute detail about a specific organ, and this is what you call it when it is not functioning. But as always, if you have any types of questions, concerns, or otherwise, or you just want to hang out and chat, then stop on by and ask me whatever questions you may want to. See you later.